you scanned the internet looking for chicks with pierced nipples, and you slipped a couple clicks and went and found the talking cripple. His concept is to share with you his many thoughts, and it's clear-headed cause he never drank a beer or hit the pot. So if you have an open mind and a willingness to learn, stay tuned to this page and just see what you may learn. Now grab yourself a snack, kick back and enjoy the unique views of life brought to you by crippieboy.
Hey everybody, today I want to talk about why I have a problem with skilled nursing facilities. I get this question a lot. I tend to speak pretty openly about my distaste for nursing facilities, institutions, and why I really fight to get people the right to live in the community and get the kind of services they need to live in the community. Primarily I talk about people with disabilities, but I also feel the same way for the elderly, for children, for young adults, older adults. Everybody should have the right to live in the community and have the freedom of choice in where they live and who they live with, and just have basic freedoms that every American expects to have. Nursing homes are a big cash cow for a lot of for-profit companies, and those companies use the money they make off the government, because most nursing facilities are paid for by Medicare and Medicaid dollars, and they use that money to pay off politicians, buy off elections. They call it campaign contributions. I call it buy-offs, and they get a lot of political influence that way. I've recently been trying to track some money here in Colorado on why 60 nursing facility beds were approved in an area that was already oversaturated with nursing homes, empty beds sitting unused, and yet a new facility was approved. Now, it was supposedly a better facility, and I think it actually was, something called the greenhouse model, better than the cold, dark, and dirty 1960s, 1970s era nursing facilities that most people think of when they think about a nursing home. But it's still a nursing facility. People still are not given the freedom to live exactly how they want to live, do the things they want to do. Nursing homes notoriously are known for bad care, poor quality of care. It's all about checking off boxes, making sure that you did the minimum amount, and not really putting in any extra work. People come in with one skin sore, leave with 5, if they ever leave. The choice is the big thing to me. The choice of where you live, who's doing your care, what you're having for dinner, what time you get out of bed, what time you want to go to bed. If you get out of bed, those are all choices that all of us get to make. And unless it is somehow not, if you are not able to make that decision on your own, you might need some help with that. Whether it's a person with an intellectual or developmental disability, or a person who's older that maybe has dementia or Alzheimer's. Some of those people do need some help with those decisions, but they could get that same help in their own home, in the community, or in a host home, or even a group home. I'm not a big fan of group homes, but it's at least a step towards the right direction. Just the least restrictive environment. That's the important thing. And that is what the Olmstead decision in 1999 by the Supreme Court said. The people have a right to live in the least restrictive environment. I'll do a complete video on the Olmstead decision. But essentially, it said people have the right to live in the community. It is a civil right to live in the community. And if they don't oppose living in the community, then that should be the first option given to them. Unfortunately, that's not how it is. And I'm very happy to see the Obama administration in the last couple of years aggressively going after states who are forcibly putting people in institutions. There's a few cases out of Florida dealing with children who have been forced into institutions because that's the only place they can get the services they need. And so their families have no choice but to put them in an institution. And that's just wrong. That's just wrong. It's 2013, and that is wrong. The Health and Human Services Office of the the OIG, the Inspector General, the Office of the Inspector General from Health and Human Services released a report in the last couple of days about nursing facilities and an investigation they did, and they found that care plans were not properly written. So they didn't. If the care plan isn't written, then the resident, the patient, doesn't get the kind of services they need. If it's not in the care plan, I can about guarantee you it's not being provided. That's just the way things are done. People work to the minimum requirements in the care plan. Discharge plans were even worse. And discharge is important. Nursing facilities are always going to exist. There's going to be a need for rehab. And for some people at end of life, that may be the only option for them as well. A nursing home is a waiting room for death, whether you go in at 16 or 86 or 106. It's a waiting room for death. That is what it is. And the discharge planning is very important if we're going to get people out. And the other thing the Inspector General's office found was the quality of care was terrible. People, like I said, would go in with one wound, come out with several. Medication management was awful. People on psychotherapy drugs that had no need for them, they're being prescribed off-label, which means that the person doesn't have psychosis, yet they're on antipsychotic medication. A drugged person is an easier person to deal with. If you keep them doped up enough, then they don't fight you. And again, that's just wrong. People have a right to speak their mind, and if you're in a nursing home, you're probably not happy. You're probably going to speak your mind a lot. Therapies were bad too, and that goes back to the care planning. If it isn't in the service plan, if it isn't in the care plan, then the person isn't going to get it. So if it doesn't say they need to, walk every day or to be stretched or to get in their wheelchair, chances are it'll never happen. The bare minimum requirements is all the staff will do in most nursing homes. Yet the states continue to pay them more and more money. In Colorado, in the last 8 years, home health rates have remained the same. The reimbursement Medicaid gives home health agencies has remained the same. Meanwhile, skilled nursing facilities, SNFs, SNFs, have gotten a 25% increase in how much they get to essentially provide the same services. People need the same basic services whether they live in their own home or they live in a nursing facility. So why is it the nursing facilities need a 25% increase in what they get? Meanwhile, home care gets the same amount. Meanwhile, inflation is up 30%. So they're both behind inflation, but the home health is way, way, way behind. And that's just unfair. It makes it much more difficult for us to hire good people because they can get paid more money to go work at a nursing facility. This is a big problem, and we have to do something to change it. Today's March 1st, and something called Colorado Choice Transitions rolled out today here in Colorado. It's a Money Follows the Person grant, and the objective is to de-institutionalize people. There's a reason the federal government is putting up this money, because the goal is to de-institutionalize people. Yet, as I said, in Colorado, last year, a 60-bed nursing facility was approved. Those beds would cost the taxpayers of Colorado $1.35 million per year. That's a total cost of $2.7 million to taxpayers, because the feds pick up half and the state picks up half. That same money could serve twice as many people in the community. It costs $28,000 more a year to lock somebody in a nursing facility than it does to allow them to live on their own in the community. Granted, you get a roof over your head when you get the nursing facility, so you take that out of that $28,000. You're still at $18,000. Let's say they live in a pretty nice place. Still $18,000 a head per person to have them in the community. And that just makes more sense. We just need to get better services and funnel more of our dollars into the community, where the dollars go directly to caregivers. I think that's an important point most people miss. In a nursing facility, it's not the CNAs making more money. It's not even the nurses making more money. It's the administrators and the investors who own the nursing facilities who get richer and richer and pour more money back into buying off politicians so they can continue to get more money in their rates. And that's ridiculous. In home health care, most of the dollars roll right into the direct care providers' pockets. The single mothers, the young adults, the nursing students, the therapy students. There's a lot of really good people in home health care who are struggling to survive, but really look out for those of us who need their services. I personally get twice a day home health care. When we got over a foot of snow the other day, I managed to get somebody to come to my house and get me in and out of bed. Was it easy? No. but they care about my well-being, and they, even though they don't make a ton of money, they're still willing to come and help me out. And they would rather work for me in the community than to go work a day in a nursing facility. And I have to give a lot of respect for those folks who don't just focus on the money piece, because the nursing facilities can pay more because the government reimburses them at a higher rate. So I'm going to end the video there, but we really need to work on these community-based options. And like I said, I'll put out an Olmstead video soon to talk about why community-based care is required under the ADA. Thanks for watching, and next time I'll try to put out a little happier, more cheerful video.